you can see an X-ray, you see the initial lesions, but with the AI, first of all, you see double the ones that you didn't see. And for the patient, you can show to the patient, these are the initial lesions, they see it. And this is also important for the communication to the patient.
That's so cool. Hello, everybody, and welcome to Schein Chats. My name is Dr. Ryan Hungate. I'm the Chief Clinical Officer for Schein One, and today we are excited to have the founders from vVardis. So thank you so much for being here. Can you elaborate? And you guys are obviously doing some really cool stuff with vVardis. I think it's like the first of its kind, and I think it's really making a big change in the industry, not just for the industry, but also for the patients, right? Which is the exciting part. So can you elaborate on how biomimetic dentistry principles, well, that's a mouthful, right, are influencing preventative care approaches in dentistry?
First of all, thank you so much for your introduction, and we believe this is really a game changer in dentistry. So the best thing is to explain it and compare it with medicine and dentistry. Medicine, you treat subclinical signs. So this is really, treating subclinical signs can be lifesavers. And that's why treatment of subclinical signs is actually the foundation of modern medicine. And for example, if you have high blood pressure or high cholesterol, you treat it because it can lead to heart conditions.
Yes, well.
And now comparing it with dentistry. In dentistry, subclinical signs of caries disease, which is the #1 disease in the world, are non-cavitated incipient lesions. And how do we call them? Do we call them watch it?
Yeah, I'm going to watch that, yeah. We know we're going to watch it because later it's going to become a cavity, right?
Watch them because we don't treat them, and if we would treat them, we would have to remove too much healthy tooth structure, and as conscious dentists and professionals, we prefer not to.
Yeah. It's like if you're a pessimist, you go after it. If you're like, most of us are very positive and we watch it, right? So it's very normal, but that's not good because we know what's going to happen, right? Nobody really changes their habits at the end of the day. Not that often. Every so often you can do it, but it's not fun. That's a big change, but you guys can help fix that though, right?
Exactly. I mean, until today, we had no solution. And as dental professionals, we were all waiting since decades to have a solution for these watch areas. Thinking of 80% of your patients sitting on the dental chair have these initial lesions. And actually, you almost treat none of them or very few of them, and the rest you send home. And if they come back, maybe in 5 years when they're in pain, and then it's too late. So you send them with an infection home. And that's why we're so excited that we have now, for the first time, a really solution for it. And thinking of also the initial lesions, that 80% of them are interproximal, so you cannot do any sealant there. And also thinking of the ones buccal, or the white spots that come during the orthodontics treatment.
It's home with me.
Absolutely.
So
you can now treat them. So we're really excited about this product.
That's awesome. And it sounds pretty simplistic as well, right?
Yes, it is really this, because this is a biomimetic system. And it's for treatment of incipient lesions and non-cavitated ones with guided enamel remularization. And it's very, very easy to apply. It takes you about 3 to 5 minutes. We can, and it's non-invasive, as I said before. It doesn't stain. And the great thing is also we have so many studies, 25 years of science behind this.
Wild.
More than 230 peer-reviewed publications. And over 10 years, patients have been treated safely. Hundreds of thousands of patients in Europe and in the US.
Here I should say that alone, this year, almost in the last 3-4 months, almost 100,000 patients have been treated in U.S.
That's awesome.
That's really, we are very excited.
And it's for everyone. It's for adults, but also for children.
That's so cool. Yeah, I mean, that's what I was talking about with you earlier with the ortho side of things. If you're an orthodontist, every single kid I know walks away with some sort of an incipient lesion, right? It's just kids, they don't brush their teeth the best, especially when they've put a chain link fence in their mouth, it's a little bit harder.
And you tell this, I mean, I have 4 children, 2 of them are teenagers, and I notice you can tell them all the time, brush your teeth, but forget it. It's so hard. And the other thing what I would like to mention, the beauty of this product, what I love, is that you don't need another appointment. And thinking about also about all the no-shows. So this is so easy to apply. The dental hygienist can just use it after her cleaning. The last 5 minutes, she can treat actually 3 to 6 lesions. The orthodontist, during the checkup, he can just treat the white spots. You don't need to take the braces away, so you don't need to remove it. And this is also amazing. And what we used to do also as dentists, before placing crown or the filling, we used to also treat the neighbor tooth.
Gotcha.
So that was also great.
Also, Ryan, this is really so. We are so happy about this because we started out, we led public pediatric dental clinic in Switzerland and treated there thousands of children, also many from low-income families.
Yes.
And there we found ourselves facing a lot of challenges and limitations.
Here.
Because mostly the children came too late, or when they came within conversion, we didn't treat them, and we didn't. They came again too late, and it was so difficult to treat them, as you know, treating children. And they were waiting for so long, having this, and that's why Haley and I, when we saw this technology, we said we have to really put all of our resources here into this technology to support it, to make an impact, because we believe this technology can make a huge impact on humanity.
Absolutely. So another piece of this that I thought was very interesting, and here at Thrive Live as well, I had never thought of this, right? Integrating this in with artificial intelligence. Right? Because when you hear like, a product with AI, you're like, okay, everybody likes to throw AI in everything, and that's just a buzzword.
Yes.
No. Now we have, with our AI platform, on the Dentrix platform, we can actually identify these incipient lesions, and then you can treat them. So sometimes even like things you don't see, the AI is catching, and you're able to do this.
And this is really that we are seeing it also. I mean, you can see an X-ray, you see the initial lesions, but with the AI, first of all, you see double the ones that you didn't see. And for the patient, you can show to the patient, these are the initial lesions. They see it. And this is also important for the communication to the patient.
That's so cool. Well, thank you so much. I know that's so brief. I want to hear so much more about this. So for everybody else out there, thank you for tuning in to Schein Chats, and we'll see you soon.